Good evening to all the aspirants present here. Today's topic is MRCP PACES. It's actually an introductory session, and the faculty that have joined us is Dr. Avijatri Dutta, sir. He is a consultant critical care medicine at Manipal Hospital, Kolkata. Thank you, sir. So you may carry on.
Okay, thank you so much. Now, today our session is primarily on MRCP PACES and overall view of the examination process. But before we start, it is important for us to understand what is MRCP UK means. MRCP UK is membership of Royal College of Physicians of United Kingdom. First and foremost, this is basically an postgraduate qualification. However, this is actually an entry level examination to higher specialist training in United Kingdom. Now, regarding MRCP UK, there are basically three steps you need to complete. First is MRCP UK, that is part 1. Then is part 2 as PACES. That completes the entire system, and the entire period of eligibility stands at 7 years, and for each and every part you have 6 attempts, right? Obviously, first you have to get through the MRCP part 1. Now, what does MRCP part 1 actually assesses? It basically assesses the width of your knowledge. Basic medical sciences and related questions are included in MRCP part 1. Now, in part 2, basically, they examine the depth of your knowledge, and then it comes to MRCP PACES. As I mentioned, the entire time period is 7 years. You have to clear the MRCP part 1 first. Regarding MRCP part 2, as well as the MRCP PACES, you can give anything. Suppose you can give PACES earlier, you can give MRCP part 2 later, which is a written exam, or vice versa. So the entire time period is 7 years, and the number of attempts in each part, as per as the present guidelines, is 6 attempts. Now we come back to the MRCP PACES part. Now, as you will understand, when you go through the website, it is written as MRCP or PACES Carousel 2023. Why is it so? It is because the entire system actually changed in PACES 2023, that is in the year 2023, when the new format came into place. Right. Now we go into, since our today topic primarily discusses on MRCP PACES overview of the examination format, we will mostly discuss on MRCP PACES carousel. Now, as you see from the slides, that there are basically 5 stations, right? Station 1, Station 2, Station 3, Station 4, Station 5. And there are 5 minute interval in between, and each and every station comprises of 20 minutes. So what is your total examination time? 20 into 5 plus 25, 125 minutes. Now let us go into station 1. What is there in, you can start in any station, right? So in station 1, communication station is for 10 minutes, respiratory is for 10 minutes. Station 2 is basically brief clinical consultation, which is of 20 minutes. Station 3 is cardiovascular examination as well as neurological examination, each of 10 minutes duration, which makes it 20 minutes. Station 4 is abdominal 10 minutes, communication 10 minutes, and again station 5 is brief clinical consultation of 20 minutes. As you understand, the brief clinical consultation, actually there are stations 2 as well as station 5. Now, I will suggest this is one of the most important stations. Why? We will discuss later. But this station carries the maximum marks, 28 in each station. Now, Let us come to first station number one. So, what are the clinical stations here? In a MRCP PACES carousel, there are four clinical stations: the respiratory system, cardiovascular, neurology, and abdominal system. Let us stick to these clinical stations first. For example, in respiratory system, what will you get? There is no patient communication. Once you are there, you will be given a format which is written on the wall. What is the patient suffering from? For example, Mr. John is having respiratory distress for the last 1 month. Please kindly examine the respiratory system. So, what is important in all clinical stations are first, once the bell rings, you enter. Three things: you greet the patient, introduce yourself, identify the patient, and then carry forward. For example, you enter into a respiratory station, something is written on the board. You first see what is written on the board, wash your hands, that is very important. That is very important. Otherwise, they are going to negatively score you. Then approach the patient. For example, are you Mr. John? He will say yes. Then introduce yourself. I am Dr. XYZ, whatever it is. I am going to examine your respiratory system. Is it okay with you? He will say yes. And it is very important in an MRCP PACES examination for the patient's welfare. You have to tell the patient that at any point of time, if you feel any pain or discomfort, do let me know. This is very important. This is true for all the clinical stations. For example, the respiratory, cardiovascular will have a different scenario, neurological will have a different scenario, abdominal will have a different scenario. But what is important is here there will be physical stations, so there will be physical findings. So you need to collate or collect that physical findings. So only with repeated practice on different patients of respiratory, cardiovascular, neurological, abdominal station patients. Now here, as a total, you have total 10 minutes, but 6 minutes are for you, starting to ending. At 5 minutes, they will give a bell, which will indicate that you have 1 minute left, and the rest of the 4 minutes will be discussion with the examiners. This is true for all the clinical stations, that is respiratory, cardiological, neurological, as well as abdominal stations. As you see in station number one, there is also a communication station of 10 minutes. Now, before this station, you will be given a scenario. Suppose the scenario can come anything. For example, breaking a bad news, declaring brain death, organ donation, and so on. So you have to go through the scenario, and when you enter the station, it is most likely a surrogate or some patient's relatives, could be daughter, could be son, who will be sitting, and you have to discuss the entire scenario with him or her. So this is regarding the communication scenario. Next is the consultation scenario. In consultation scenarios, basically it is how we deal with a patient in an outdoor basis when we see a patient in an OPD. For example, what you do? A patient comes to you, you take a clinical history, you do a physical examination, you explain the patients what are the possibilities, you write the management plan as well as the possible investigations. So everything is 20 minutes in brief clinical consultation, 15 minutes for you, 5 minutes for the examiner to discuss. Now, regarding this, in 13 minutes, you will get a bell, which will indicate that you have 2 minutes. Now, in both the communication station as well as the brief clinical consultation, it is very, very, very important to address the patient concern. If you don't ask about this patient concern, then you are going to be negatively marked. As in following slides, we are going to discuss about the different clinical skills which are assessed in this PACES carousel or the PACES exam. So, why most of the candidates fail? Primarily because they don't address the patient concern when you are in communication station as well as in brief clinical consultation station, and when you are not able to elicit the physical findings when you are in the clinical stations: respiratory, cardiological, neurological, as well as abdominal. Because in this clinical station, there is basically no communication with the patient. And these patients are real. You read a scenario, you do your findings, and then discuss with your examiner. Right. So now let us move on to what are the clinical skills basically they are going to assess. There are basically, seven skills: A, B, C, D, E, F, G. These are assessed in these stations. Now, if you go through the website, you will see that what is A? That is physical examination. What does physical examination mean? Demonstrating a correct, thorough, and systematic technique of approaching an examination to a patient. So this can only come with more and more practice. Next is identifying physical signs.